Hello, hello, welcome back here to another dissection. One is number 22, the posterior and anterior triangles of the neck. So we'll do our best to get through this. Do you remember when we started this dissection process? We started way back in the upper thorax, and we have basically made our way all the way around the whole body. And now we're back to the lower part of the neck, which pretty much brings us back to where we started near the upper thorax. So you've done a lot of work to this point if you followed with us this far. Now, I want to talk about these couple of areas in the front of the neck. If we look at a cross-section view here through the neck, this is an interesting part. You've got a posterior section, which is basically the spinal cord here and the vertebral column. Then you've got all these muscles around here that help support the spine and move it. And then you've got an anterior section right up in front here. Now this is the visceral compartment. This is where you've got some muscles here, obviously, too. We talked about the sternocleidomastoid and the strap muscles here. They'll help to support and move the neck as well. And then you've also got the trachea and the esophagus behind that. And then to the sides here, you've got this vascular compartment on each side. And we've spent a little time talking about the carotid sheath, the common carotid artery, the internal jugular vein, the vagus nerve sits right inside there. And then to the inside of that, on either side of the spinal column here, you've got the sympathetic trunk. Remember the sympathetic trunk way back when too. This is immediately behind the vascular compartment here, that sympathetic trunk. And so really, if you look at this, there's really only fascia separating this posterior from the anterior sections. So once you remove the skin, you could pretty much take a gloved hand and push it all the way through to the other side. I don't know maybe why you'd want to do that, but you could. There's just fascia separating this anterior compartment from the posterior compartment. Pretty interesting. Well, some might think so. We'll talk about these areas now for a little bit of time here. Now, the posterior triangle is this section right through here, and then the anterior triangle is this section up in here. Now, if you look at it, the sternocleidomastoid is kind of a landmark for both of the posterior and the anterior triangles. It's the front of the posterior triangle. You have the upper trapezius as the back of that posterior triangle, and then the clavicle kind of sits at the bottom here, and the omohyoid's down there too, but that's kind of the posterior triangle compartments there. The anterior triangle of the neck is really the sternocleidomastoid in the back. On the top, it'd be the mandible, which is kind of right underneath here. You can see the masseter kind of right here is the mandible sneaking around. That'd be the top portion, and then right down the midline of the neck would be that front part of that triangle. So front, top, and back of the triangle. Here's the anterior triangle. So let's talk about some of the things that we'll find within the posterior. We'll start with the posterior triangle and then make our way up towards the anterior triangle. The first thing is the upper trapezius. Let's just start at the back side here, attaching to the spine of the scapula. You can't quite see that in this shot here. And then the acromion, and then the distal third of the clavicle or so here is the upper trapezius, part of the trapezius. The clavicle, which is the bottom portion here, this is coming from the acromion process. Here you can see the AC joint, and then coming down to the sternum here, the SC joint, the sternoclavicular joint. Remember that this is the only spot that the SC joint, that your shoulder blade and upper extremity have access to the body, bone to bone. That's the attachment point right there. So the clavicle is really an important structure for attaching the upper extremity and scapula to the body. That's there. Now, the couple other muscles here, the omohyoid, you can see the bottom portion of that here, the inferior belly of the omohyoid. Here you can see it on the top portion here. It's going to sneak underneath the sternocleidomastoid, and here's that inferior belly. This is going to come down and attach to the superior angle of the scapula from the hyoid I guess really off of the scapula to the hyoid insertion and origin here, but that's the omohyoid there. Let's see, levator scapula. Here's splenius capitis coming up to the base of the skull there, and then here's levator scapula, this bone, this muscle here. This is really the majority of the floor of the posterior triangle is the levator scapula. From the transverse processes of C1 through 4, to the superior angle of the scapula down this way. The cranial nerve number 11 lays right on top of the levator scapula. We'll see that in a little bit here in a different view. Here, I guess I can show it right here. So here's levator scapulae right there, and then the spinal accessory nerve, cranial nerve number 11, sits right on top of that. Here you can see it kind of sneaking up to insert onto sternocleidomastoid and then making its way down to the upper trapezius. But let's head back to this picture here. Now what's not shown on this picture is the platysma. Remember, we saw that in a previous dissection coming really in the it's found superficially in the fascia from the lower part of the face down to the shoulder underneath the chest here, kind of down this way. It's more within the skin. It's within the fascia superficially. The spinal accessory nerve we just talked about here. Should have just kept going with that one. You can see how it's coming. Here you can see it sneaking out with through that, comes out of that jugular foramen, travels through the anterior portion of the anterior triangle, and here you can see the sternocleidomastoid resected up, where it's going to come into the posterior triangle of the neck by sneaking a branch over to the sternocleidomastoid, and then down to the underside of the trapezius right here. And that again is going to be motor control to the sternocleidomastoid and the trapezius. Here you can see a blood vessel we'll learn coming off of the thyrocervical trunk in just a little bit here, called the transverse cervical artery. That's going to join up with the spinal accessory nerve, cranial nerve number 11, to supply the trapezius with nutrition there. We'll talk about that in a little bit. Other nerves coming up from here. This is just an interesting shot here of some of the cervical plexus nerves that we'll talk about. There's one called the lesser occipital. It's kind of underneath the sternocleidomastoid. Here you can see it kind of sneaking out this way from the cervical plexus. There, coming up to ascend toward the back of the head. Up here between the sternocleidomastoid and the upper trapezius. Just in front of that is the great auricular nerve right here, sometimes called the greater auricular nerve, depending on the author or how it's depicted on the drawings here. But this is the great auricular nerve coming off of there. And then you've got a little bit lower, these transverse. Let's go. So here's lesser occipital, and then the great auricular coming up this way. Here you can see where it would come around the sternocleidomastoid like it is here. And then the transverse cervical nerves are going to come. These are part of, again, the group coming off the cervical plexus. They're going to travel in front of the neck and provide sensation into these areas in the front of the neck. And then down a little bit lower, now you've got the supraclavicular nerves above the clavicle, supraclavicular, coming down again from the cervical plexus, traveling down behind the sternocleidomastoid and in front of the shoulder, right through here. Okay, in this picture here, we can also see just a bit, we'll talk a little bit more about the external jugular in a little bit, but the external jugular vein sits right on top in front of the sternocleidomastoid. The internal jugular sits behind the sternocleidomastoid within the carotid sheath with the common carotid there. So flowing into the external jugular, you've got a couple of veins here. One is the posterior auricular vein right here, and one is the retromandibular vein right here. The external jugular is going to come down and insert right here. You can see it's cut, but it's going to go right into the subclavian vein. It's going to just dump directly into the subclavian vein right before it joins up with the internal jugular to become the brachiocephalic vein, dumping into the superior vena cava. So we'll see more of that as we get going later on here. But another shot of those same nerves we just talked about. Here's a shot from Netter. Kind of we're looking at this purple box here. So those nerves that we're looking at these are all again off of the ventral rami of the cervical plexus, particularly. So you've got posterior auricular. I'm sorry, lesser occipital right here coming up onto the base of the skull. You got the great auricular, sorry, I was thinking about an artery, but the great auricular coming up behind the ear. Here you've got the transverse cervicals, and then the supraclavicular coming down this way. Now off the dorsal rami is this greater occipital, so lesser occipital off the ventral rami, greater occipital off of the dorsal rami, coming up, supplying the majority of the back of the occipital area of the skull. And then you also have these sensory branches coming down, supplying over the back side of the neck here on the posterior aspect of the trunk. Okay, let's talk a little bit about blood supply for a second here. Now, I mentioned the thyrocervical trunk. Now, this is under the sternocleidomastoid, so you can just barely see a piece of it here, but if we resect this up like is shown here, actually it's just been cut and removed, so we can see underneath here. Here's a good couple sections of this. This is actually the second branch off of the subclavian artery. The first branch was the vertebral artery. Remember that one? That one goes up through the transverse processes of the cervical vertebrae, joins together with the other side's vertebral artery at the basilar artery, and then we come up into that circle of Willis. Remember that from a previous lecture? So that's the first branch off of the subclavian arteries on each side is the vertebral. The second branch is the thyrocervical trunk. Okay, now we're going to talk about some branches of that because that's going to be an important thing to think about here as we do this dissection. The supraclavicular, I'm sorry, my bad, supraclavicular nerves right here, supraclavicular. Now we're going to talk about the suprascapular, my apologies, suprascapular nerve. Boy, oh boy, I'm having a hard time. I'm not going to restart this just to save us all some time here, but the suprascapular artery is the first branch of the thyrocervical trunk right there, and this is going to travel through the suprascapular notch. Remember that becomes a foramen when that ligament covers it on the superior angle of the superior portion of the scapula. This is going to basically come down and supply blood to the muscles in the back of the scapula, supraspinatus, infraspinatus, teres minor, teres major. That's what's going to come down here from that suprascapular artery, the first branch off of the thyrocervical trunk. The second branch is this transverse cervical artery. This is going to come straight back, go under the trapezius, and meet up with the spinal accessory nerve, cranial nerve number 11, coming down to supply these trapezius and the sternocleidomastoid. So the transverse cervical is right there. If we continue this up, there's going to be an ascending cervical artery that comes right up underneath, kind of behind the internal jugular. Let me find a different shot of this. Let's maybe go to this one. Here you can see suprascapular, transverse cervical. Here you can see ascending cervical coming straight up this way. And then you'll have an internal thyroid, and that's going to come up here, going up to the thyroid gland here. Now, the thyroid is actually gets its nutrition from two different branches. Remember, the superior thyroid is going to come down here from the external carotid. That's going to be a branch to the thyroid. But then the inferior thyroid is going to be the branch off of the thyrocervical trunk coming up this way. So thyroid gets its nutrition from a couple different sources. Okay, let's keep talking about that posterior triangle for a moment now. Let's go back to this shot. Here you can see levator scapula, and then right in front, kind of lower to the levator, are these muscles called the scalene muscles. Now, what's interesting about these is I'm told the Greeks thought these looked like they were in line, kind of lines on a ruler. They were right kind of in scale to one another. Maybe that's where it gets its name, the scalene muscles. There is a posterior, a middle, and an anterior scalene. Right here, the anterior coming from the transverse processes of C3 through 6, coming down to the first rib. The middle scalene coming from transverse processes of C2 to 7, coming down to the first rib next to the anterior scalene, and the posterior scalene coming from transverse processes of C4 through 6, coming down to the second rib. So this one comes down a little bit further, not attaching to the first rib here. Now, what's interesting about this here, you can just see a little piece of it. Let me go back to let's go back to this shot here. Here you can see anterior scalene, middle scalene, and posterior scalene. And you can see the brachial plexus coming right out between middle and anterior scalene. This is a big site of potential entrapment. Those dealing with thoracic outlet syndromes could certainly have an irritation in this area here if those anterior and middle scalenes are tight, or if the first rib is elevating with breathing strategies that aren't proper, or other things that can cause some irritation through this front neck area. The sternocleidomastoid being too tight, pressing down on here, can be an irritation in there as well. What's also interesting about this is the subclavian artery. Here you can see the vertebral artery branching off, the thyrocervical trunk branching off, and then right after that is the continuation of the subclavian artery, and that goes behind the anterior scalene as well. So coming out of between the anterior and middle scalenes is the brachial plexus and the subclavian artery. So that's there's a lot going on right there. The suprascapular artery here coming down, and then the transverse cervical artery, those both go in front of the scalenes. So they're coming in front, while the subclavian artery and the brachial plexus come behind the anterior scalene. Now, also on this picture, what you're seeing is the phrenic nerve. The phrenic nerve is a big one here, coming from the nerve roots of C3, 4, and 5, way up in the cervical spine. I learned this as C3, 4, 5 keeps you alive, or maybe C3, 4, 5 keeps the diaphragm alive. These are coming right down here. Remember that they go through the thoracic cavity and within the pericardial sac, ultimately going down to innervate the diaphragm. So this is the nerve that tells the diaphragm to contract. So descending down, you can see the laying right on top of the anterior scalene muscle here. That's a good landmark to be able to identify the phrenic nerve as it comes down. Let's see, axillary artery comes down. You can just barely see it here. As soon as that subclavian artery comes underneath the clavicle, or just over that first rib, kind of right in this area, now that's subclavian artery becomes the axillary artery. So that's what we're looking at, right just distal to the clavicle there. Okay, let's now look at some of the anterior triangle here. Just in front of the sternocleidomastoid, here you can see, let's see, here you can see let me go to this picture here. Just another shot of this. Here's kind of this anterior portion of the triangle. You can see the larynx up on top here with the thyroid cartilage, the cricoid cartilage. The esophagus would be behind that, but just in front of that would be the pharynx. So you got the larynx, the pharynx, then above that, and then below the pharynx is the esophagus coming down behind there. The thyroid gland, if we look at that real quick, again, larynx here, pharynx right behind it, and then esophagus below that. Here, sitting on top of the superior portion of the trachea, is the thyroid gland found within that anterior triangle. Most people just have these two lobes of the thyroid gland separated or connected here by an isthmus in the middle. Majority of people will have just the two glands. A minority will have this third pyramidal lobe here, coming up towards the thyroid cartilage. May even be able to see this. Might be visible sometimes. This is only going to really be an issue if you need to do that emergency tracheostomy. Remember, that needs to be in the space between the cricoid and the thyroid cartilages, and then you're going to have to cut that pyramidal lobe, and that might bleed a little bit, but it's in the case of trying to save someone's life, you can deal with a little bit of blood coming from that pyramidal lobe of the thyroid gland. I wouldn't worry about that too terribly much. Okay, now let's go back to the anterior triangle here, the carotid sheath, which you can see right here. If we go back to this shot, here you can see the carotid sheath, which again is going to, well, let me go to, this one's just a little bit nicer. If we go here, you can see the carotid sheath, the sternocleidomastoid lifted up kind of right on top, right in front of the anterior scalene here. You've got the common carotid artery, you've got the internal jugular vein, the vagus nerve sits right inside there as well, and then you'll have the sympathetic trunk behind there too. On this shot, here you can see the sympathetic trunk right behind the common carotid, coming up this way, which kind of behind that carotid sheath. Remember in that cross section here, you could see it just sitting right behind it, not within that vascular compartment. Now the nerves, let's just look at the nerve order here, coming from the front of the neck, going backwards from anterior to posterior. There's that, if you've ever responded to an invitation to a party or a wedding, you've had to do an RSVP. Something in French, I believe, but we're going to use that acronym as kind of our guidepost to noticing some of the nerves here from anterior to posterior. Now the first one, the recurrent laryngeal. Remember, this is off of the vagus as it loops around the arch of the aorta and then comes right back up the side of the trachea. Here you can see it coming up, and next to the trachea, going to the larynx. This is going to supply innervation to all the other muscles of the larynx except for the cricothyroid, which is right here, which you can see is supplied by the external laryngeal branch from the superior laryngeal nerve, which comes off of the vagus a little bit higher. So here's the internal going to the glottis. Here's the external off of that superior laryngeal, external laryngeal going to the cricothyroid, coming up this way. That's the recurrent laryngeal, R. RS, the sympathetic trunk, right behind here, was right behind the common carotid, and the sympathetic trunk coming up. Vagus, RSV is vagus nerve coming right here, coming down, right next to the sympathetic trunk, found within the sheath. So that's the difference. You're going to be able to tell which one is which here, the sympathetic trunk or the vagus nerve, because the vagus is found within the carotid sheath, the sympathetic trunk is not. That's behind it. And then P, phrenic, which sits right over the anterior scalene, the phrenic, RSVP, recurrent laryngeal, sympathetic trunk, vagus nerve, and then the phrenic nerve coming down here, RSVP. Okay, let's look at some of the external carotid arteries. Now here you can see the carotid sinus, the internal carotid coming up, and then the external carotid has been cut here. So let's find a different shot of that. Go back to this, let's see, not that one. Here, let's go to this one here. Here's a nice picture of your your external carotid arteries as it comes around. Now, there's another acronym we're going to learn to find all these branches. We're not going to be able to see all of it today because the mandible is still in the way. In tomorrow's dissection, we'll be able to cut this the ramus of the mandible off to see the maxillary artery, and then its branches off of that, which will be extensive. But let's start way down here at the external carotid. The first branch off, and you're going to try to dissect this to make it look nice and beautiful so we can identify these. The first branch off is the superior thyroid artery off of the external carotid. And that's going to go to the the thyroid gland. Now there is a branch coming off of it here, the superior laryngeal, which is going to the larynx, the first branch off of the superior thyroid. Okay. Next branch up is going to be the ascending pharyngeal. This is actually going to go behind, going off the back side of the external carotid, traveling between the external and the internal carotid arteries. And this is going to supply the wall of the pharynx in the back here, the ascending pharyngeal. Next branch off is the lingual artery. It's a big artery. It's fairly big, going right to the tongue. Lots of blood supply to the tongue. Under a lot of pressure, this external carotid. And the next branch up is the facial artery right here. Now remember, that one's going to come underneath the mandible, and then it's going to loop back around. It's going to come up here. Remember that you can get a pulse sometimes off of that, just on the body of the mandible here of that facial artery. And this is going to then branch into the superior and inferior labial arteries around the mouth, and then it's going to come up, ascend up the lateral aspect of the nose, coming around that way. So the facial artery is going to branch from there, but that's that next branch off the external carotid this way. The next branch off is going to be the occipital branch, which is this one right here, coming up towards the back of the external carotid, again going towards the occipital region of the skull, back this way. Just a little bit north of that is the posterior auricular artery, coming off of the external carotid, going to the back, behind the ear, supplying that area behind the ear. And then there's a big branch here. You can just see it ducking underneath the ramus of the mandible. That's the maxillary artery. And again, this is a big artery, totally hidden behind the ramus. So we're not going to be able to see this today, but we will take this off in the next dissection. When we do that, we'll also be able to see the lingual nerve coming down, as well as the mandibular division of the cranial nerve number 5, the V3 of cranial nerve number 5 coming down from the foraminal valley right through here, which we'll kind of trace those branches on the next dissection. And then continuing up is the superficial temporal. That goes right up the side of the head here. It branches out to supply the side of the head. There is a transverse facial artery here that comes off of the superficial temporal as well, but we'll focus more on the superficial temporal. Now, the acronym that I learned going through this myself was kind of a silly one. You can look up, there's all sorts of, some of them are fairly inappropriate if you Google external carotid branch mnemonics. You'll find all sorts of stuff that will probably just not entertain, but this one's kind of fun, I think. Should all legume farmers only plant more soybeans? That one makes me laugh. So, should, superior thyroid, all, ascending pharyngeal, legume, lingual, farmers, facial, only, should all legume farmers only, occipital, plant, posterior auricular, more, maxillary, soybeans, superficial temporal. So again, superior thyroid, ascending pharyngeal, lingual, facial, occipital, posterior auricular, maxillary, superficial temporal. Should all legume farmers only plant more soybeans? Ooh, boy. Okay. Hopefully that was good. Hopefully that's interesting. Hopefully that made some sense to you. But those are the branches that we're going to pay attention to today of the external carotid. Just to review here, sensory information from the cervical plexus, C1 through 4. Again, off the ventral rami. This is coming from underneath the sternocleidomastoid. Here you can see. You've got the lesser occipital. You have the great auricular, the transverse cervical here and here, and then the supraclavicular artery nerves off of the cervical plexus. And then the dorsal rami off the cervical plexus is the greater occipital. Lesser occipital is off the ventral rami. Greater occipital is off the dorsal rami. And then these branches to the posterior neck. And here, if you've taken lab and anatomy or physiology, maybe you've done two-point discrimination, and these nerves are just really quite terrible at picking up two-point discrimination. They're not very good sensory nerves in the back of the neck. If you've tried that, try two-point discrimination on your finger or on the back of your hand. Try it on the back of your neck. See which one you get more of, and you'll be very surprised at how bad the dorsal rami are of the cervical plexus at determining that kind of information. Okay, let's review again here this external jugular, just real quickly here. The external jugular, remember, is on top, it's outside of the sternocleidomastoid, but it's going to drain a couple of things. The posterior auricular vein is going to come down into there, and then the retromandibular vein is going to come in here. This is going to drain part of the face. The facial vein, here you can see, also drains part of the face. That's going to drain mostly into the, some into the external jugular, but mostly into the internal jugular here. The retromandibular vein is pretty much draining what's behind the mandible and in front of the ear. Okay, so where the external carotid ascends up, the retromandibular vein is going to be the major vein up there. So draining mainly into the external carotid, boy oh boy. Hopefully I said external jugular. The retromandibular vein mostly draining into the external jugular vein, but there is some coming down into the internal jugular as well, but mostly into the external jugular here. The hyoid bone, just a review of this too. These strap muscles, these are found within the anterior triangle of the neck here. So inferior to the hyoid, remember you've got the sternohyoid right here. You've got the omohyoid in front, coming from the superior angle, coming around. This way it's cut, going up to the hyoid. And then you've got the sternothyroid, and then behind this proximal belly up here of the omohyoid, you've got the thyrohyoid. So sternothyroid, thyrohyoid, sternohyoid, omohyoid. That makes sense? You can look back and review some of that if you need to, just as those strap muscles supplied by the ansa cervicalis coming up this way. So underneath the strap muscles here is the larynx. Now, again, the larynx, we'll deal with this more as we go into the neck and other dissections further, but a couple of important cartilages here. The thyroid cartilage right up on top. This is the big prominent Adam's apple. You can feel that big kind of divot here, the superior notch of the thyroid cartilage. And then the cricoid cartilage is the cartilage below that. That's going to be more narrow in the front and wider in the back. So from a side view, here you've got here's anterior, here's posterior. Here you've got the wide thyroid cartilage. And then the small cricoid cartilage, but in the back it's a much broader cricoid and a much smaller thyroid. And then on top of the cricoid cartilages here, are on the back side here, these are arytenoid cartilages. These act like little levers that they pivot around here to put tension on the vocal cords, which attach to there. On top of the arytenoid cartilages are these corniculate cartilages, and you think, well, what in the world are these little cartilages doing way up on top of the arytenoid cartilages? These are really a good landmark when you're doing intubation, I'm told. So if you're looking down the throat, if you find those corniculate cartilages on top of the arytenoids, then you're going to be able to know that that's where you need to put the intubation. And then the cuneiform cartilages, I don't know that they're shown really very well here. They're kind of found within the membrane lateral to the arytenoid cartilages on each side here. These here you can kind of just see a little bit of, there's the vocal cords, but then around the sides here in the membrane is going to be those cuneiform cartilages. Here you can see the epiglottis coming right up here. When you swallow, the whole larynx pushes upwards. It kind of comes underneath the tongue and folds over the top, and this kind of, the epiglottis folds over the top of that opening to not allow food or drink to come into the larynx, but rather to go down into the esophagus. So the larynx is is really is above the trachea. Trachea is below the larynx. Behind the larynx would be the pharynx, the pharynx back here, the nasopharynx, the oropharynx, and the laryngeal pharynx right back here. And then down below the pharynx would be the esophagus coming down this way. Okay. If we look at just briefly some lymphatic drainage here of the head and the neck, this will primarily end up in nodes around the carotid sheath. So you can see where that sheath is here. These are called the cervical nodes. And they come down, you can see them kind of underneath the mandible and then down into that carotid sheath. So infections in the head and the neck will kind of accumulate here. If you've had strep throat, or if you've had your mother or your doctor kind of check your glands, that's kind of what we're checking, the nodes underneath here, these lymph nodes, to see if they're swollen. But that's primarily where you're going to find some nodes. So we might run into some of that today in our dissection as well. Well, I hope all of my blundering with the nerves, arteries, and boy, did I say jugular or carotids, hopefully that all made sense. Hopefully I did it adequately. And hopefully you learned something today. I will look forward to seeing you in lab. Thanks again for your spending some time with me. Talk to you again.